Hey, I'm Dr. Sebastian Gonzalez with Performance Place Sports Care. Today I'm going to show you a trick that I use for people with elbow impingement or posterior elbow impingement right here, and all we're using is this band right here. So what we're looking at with elbow impingement, we'll start with this model, is we're looking at, so when we bend or flex the elbow or extend the elbow, we want a nice free joint motion right there. And I'm going to turn this guy's elbow around, so we're looking at the back side now, and there's this area right here, which is this bone, which slides right into this gully. And I'll kind of turn this a little bit to make sure the camera's getting the right angle. This gully, when we extend the elbow, it's supposed to sink in here, and this is called the olecranon fossa. Okay, this bone, the section of this bone is called the olecranon process. So when we fully extend, it should sink into that to be able to create full extension. Now, what happens with impingement is, let's just say my finger is an issue right here. It's not letting it completely go in, and it's crushing the finger. Now, there's a few things which can create this, which you need to be aware of. There's a joint infection, there's fracture, there's bone spurs, and so on, which can create a fat pad or even fluid from the joint here to start distending and coming out. And as it comes out, it gets crushed as this thing starts to extend. So what I'm going to show today anyways is, and by the way, you should get this checked with a doctor before you actually start implementing some self-corrective tips. What I tell some of my patients is we're going to distract the joint, so pull it apart from both sections, and we're going to use the band for that. And what this does is kind of like, imagine a suction cup. When you pull it apart, when you're pulling it off of glass, it starts to create a vacuum. And if the issue is some of the fluid in here is starting to come out, we're going to let it suck back in before we extend. So we're going to distract, so pull apart, extend after that fluid has been sucked back in. Now, a type of band that we use is, this is a exercise band. I got it off Amazon. I'll put a link below. There's different resistances, and in case you're wondering which one, I'll just put an easy link there and list it for you so you don't think much. But I'm going to attach it to this rig because it's very stable. At home, I tell people to use a baluster, even a chair, something that someone can sit on so it doesn't move that much. What you're going to do is you form a loop, stick your hand through, palm down, grab these ends right here, and you see that it's securely around the wrist now. If you go below the wrist, oftentimes it'll distract the wrist, and if the issue is not the wrist, then we want to keep it uninvolved. So from this, I basically just pull here, both hands, and then slowly allow the band to distract the joint right here, and I'm actually contracting my tricep at the end to get active range of motion, not just let this be a passive stretch. Again, what this is doing is this is distracting and pulling the joint apart. When it pulls it apart, it creates extra space on the inside, which creates more of a suction, which allows for the fluid, which is in there, creating some of the impingement on the fat pad. When this elbow extends, it allows that fluid to suck back in. Now again, like I said before, the reason why the fluid's there is a whole different story. It could be a fracture, it could be infection, it could be a lot of things. You need to get it checked out. This is just something I recommend to my people. Okay? So after about 10 to 20 of these, a lot of times they'll get off and they'll say, look, I got good elbow motion now, and that's something I recommend they do throughout the week just to emphasize and improve the range of motion so it's not restricted and there's not a lot of guarding going on. Because it's really hard when you get restricted motion. You end up getting compensatory patterns and other things fall apart around it. So again, if this has been helpful, please like it, subscribe to my channel, and we do have a podcast as well where I answer all the questions. If you send good questions in, or put them below in the comment box, and tell me actually if you have had any elbow impingement. I'm kind of curious. It's not extremely common, but I want to hear what you do, how you got it, and share with the community below. I really think it would help everybody out. So talk to you guys soon. Take care.